Hello and welcome. This is another episode of The Nation. I'm Jessie Chahel. Today we have a compelling discussion before us where we want to explore the advancement in managing reflux. That's right, acid reflux. From lifestyle adjustments to innovative medical solutions, the landscape of reflux management is ever evolving, and we're here today to explore that. We also are privileged to have a distinguished expert in the field here with us today. Dr. Prabhjot Singh Sidhu joins us. Thank you, Doctor, for being in the studio, of course, to shed light and discuss a little bit more about things like acid reflux. That's now, as you said earlier, very common. It happens. It's perhaps, yes, you probably see a lot of your patients come through the door with that, but also dyspepsia and gastric pain. I want to start at the very beginning. Is it purely a lifestyle issue?
No.
Or is it genetics?
It's not so much genetics, unless you say it's a genetic lifestyle.
Okay.
So you've always done the bad things, you learn the bad things, and then you go from there. But dyspepsia, stomach pains, people get kind of stuck with all the different words. Like reflux, GERD, heartburn. It's all the same thing. Okay. Dyspepsia, stomach pain, the burning, poking sensation in the stomach. It's all gastritis. It's the same thing, or people here call it gastric. Now, how common it is? Well, it goes to the point where people. And I'm sure many people will just start saying, oh, it's my usual gastric, or it's my usual reflux. It shouldn't be usual. Nobody should be having it, especially if it's causing you symptoms, disrupting your lifestyle, kind of thing. So, no, it's very common, you're right.
So this is different from the term that we have here in Malaysia, masuk angin, when we have pain and we sort of, dismiss it as, I just didn't eat on time, or I ate the wrong thing, or I can't take spicy food.
But you know what? Don't eat on time. All the things you just said, it is gastric. But masuk angin can be, masuk angin from this way, or is it just there's angin, because it could be from your colon as well. But masuk angin technically goes this way. It is the same thing. Just so many ways to describe it. So cultural differences in describing it is also very important. So I take a lot of time talking to my patients because you need to understand what they're referring to exactly. Get it wrong from the start and you're down the wrong path completely.
Okay, so at its root, what are some of the symptoms or glaring symptoms that people should pick up on?
For gastric or reflux?
For gastric, let's start
for gastric, very, very simple. It's always up here, just below your ribs. It tends to be central, tends not to go anywhere else. Again, you cannot blanket cover everything. A lot of things can present similarly, and gastric may not present that way. But it's often here, and people often describe it as poking, feeling full yet feeling hungry, burping, those sort of symptoms. It then tends not to go around, tends not to be associated with fevers or anything else. But nothing is 100%, nothing all fits in a box. That's just generalization. It's very important to talk to the patient about what else could be going on. For example, some people with gastric may just present with diarrhea, no other pains.
Right.
Now, what's going on there? You have an irritable bowel syndrome situation because of your gastric. So do you treat the diarrhea? Well, if the cause is the stomach, treat the stomach, everything else gets better. People come in with for example, a headache, cough. Well, cough must be lungs, must be asthma. Well, no. What if it's reflux related? Because you have gastritis, you generate gas, fluid comes up, overspills, and now you got asthmatic symptoms. So you need to talk to the patient. Yeah, it is. So it's never safe to just, I have this, hence I must take this. No, you have to talk to your doctor, because you need to find the root cause and you get better and you stay better. But if you keep treating it like asthma, you will never get better, because you never think, the cause is actually here, but your symptom is here. Doesn't quite match, but it does. It does actually work that way. But so as much as I like to generalize things, talk to your doctor always. Don't go down the wrong path. You just end up wasting time and a lot of money.
That's right. Or make an appointment with Dr. Prabhjot. Immediately you'll be able to determine that. So there's this grey area, especially for GERD, reflux, now gastric pain, gastric pain and dyspepsia as well. The stomach, they say, is the second heart of the body, if you will. It is the central processing unit, giving us energy and so on and so forth. But when patients come through you and they complain about the heart, sort of that pain extending towards the heart, then that sort of triggers the alarm, whether is it an impending heart attack or is it simply a heartburn?
Now, it's funny, isn't it? When you get heartburn or reflux, you just brush it off. But if the patient thinks it's the heart, they run to the hospital. Now, to be quite honest, if anything's going on with your reflux, your esophagus, your stomach, we can fix it. It's not a problem, all right? But if you're having a heart attack, that's a different thing altogether. So if there's any doubt, you just go to emergency. It's much better they tell you, look, it's not your heart, it's probably reflux, then you come and see us. It's always safer to do it that way around. As much as it's, 1% chance it's your heart, make sure it's not that. If you have any doubt, ask your doctor, make sure it's not the heart, and then you can see us. It's much safer that way around. There's many times where patients walk into my clinic and say, oh, I got heartburn and things, and the story doesn't quite fit. And I send them straight to the cardiologist. And on some occasions, yes, it is actually heart-related, because you can pick up from the pattern, the description of how it is. For patients, it's very hard, and so the best advice is, if you question, is it your heart, then you check your heart. And then if it's not, then come to us and then we'll sort it out.
What options are there at this point for acid reflux or for GERD treatment? Do you go off the counter if it's generally, issues that you're having reoccurring over some time?
So reflux, everybody can get a little bit, but when it causes disturbance in your life, then it's a disease. So hence gastroesophageal reflux disease. Initially, you can try some medicines, some over-the-counter medicines, or one to just neutralize acid, some to suppress acid production, and that is addressing in the stomach. It's addressing any acid production there, because the idea of too much acid, gas production, everything comes up, you get reflux. Then what used to be the only next step after medicines, or if medicines don't solve the problem, is surgery, where they take the top part of the stomach and they wrap it round. Now, problems with that is that you create a tightness over here, stopping whatever goes from here up, because hence no reflux. But problems with surgery is that it's fixed. If you make it too tight, you can never burp. You make it too loose, you get reflux, and then it is surgery. So there's operation and so on and so forth. Though some patients get very good outcomes, and some people actually do need it, it shouldn't be the first thing you go from tablets to surgery. So now in between, there's this new things that have come. In Malaysia particularly, there's this procedure called Stretta, where basically it's done in daycare. It takes half an hour, 40 minutes to do. You come in the morning, can go home at the end of the day.
In the same day?
In the same day. There's no cutting, no surgery, no stitching, nothing whatsoever. It's endoscopy. So we have a look down into the esophagus, down to where the valve is, get our measurements, and then we put the probe down. The probe's the size of my little finger. It may seem big, but it's not, because you're kind of out during that whole time, right? And what it does...
You are out.
You are out.
Okay.
You do not know what is happening.
Right.
The anesthetist keeps you under, so you do not know anything that's going on. 30, 40 minutes. And it's a very simple procedure. And essentially what we do, we deliver radiofrequency therapy to the esophagus, or the LES, the lower esophageal sphincter, above it and below. And after that's done, two symptoms you may or may not get. It's a bit discomfort here. Of course, it's stimulated, caused some superficial injury, and a bit nausea for the rest of the day. The next day, you're back to normal. And what happens is over the next 4 to 6 months, and I've seen in some people even 3 weeks, your own muscles, whatever is there, grows. So it stimulates muscle growth, your own muscle.
Right.
There's no stitching, no wrapping. Your muscle tightens up and relaxes. As it does, there's just more of it now. And as this is a valve, well, it's not technically a valve, but it works as a valve, stopping things from moving up, your reflux disappears. So literally a one-off. And you may even be able to stop your medicines, and it's not surgery.
Right, so a one-time treatment that is non-invasive in the sense that it's not, there's no blood and no surgery involved.
No, it's not no surgery. Invasive, well, it's going inside. So that way
there's
is invasive.
There's no cutting involved.
There's no cutting whatsoever.
Right,
no.
And it uses your own muscle.
Yes,
and
it stimulates your own muscle to grow, and that's it. So I've got patients that come in with, half a cup of coffee and they can't do anything. And then some very fast, even 3-4 weeks later, walk in with their third cup of coffee, with no symptoms and no medicines whatsoever. So the results are fantastic.
And this is brand new technology.
Well, I think the awareness in Malaysia is not very good, but it's been around for at least 15 years. It's not something new. So the studies have shown that a one-off of this procedure, Stretta, you could get results that will last at least 10 years. So to have studies to show 10 years, products around much longer than that, and I'm sure it goes further back than that. But
well, we're lucky because we actually managed to bring in this particular piece of equipment, which we're going to showcase in just a short while, right after this commercial break. So stay tuned, don't go anywhere.
Saya melihat kepada prestasi pejabat awam yang begitu membanggakan. Kalau ada pun kelemahan kecil yang akan dipantau oleh SPRM, itu kerja asing. Tetapi umumnya secara menyeluruh sangat membanggakan, dan oleh itu kita memutuskan untuk menyegerakan pelaksanaan skim upah yang lebih adil dan munsabah kepada pejabat awam.
Welcome back. You're with me, Jessie Chahal. We're talking to Dr. Prabhjot on many issues of the gut or the stomach, whether it's reflux, dyspepsia, or even gastric pain, understanding better how to differentiate these different conditions and the latest solution, or rather, you say this, it's been in the market for a while now, but there's more awareness right now in Malaysia.
Yeah, so it kind of sits between medication and surgery, and there's this group of people that will benefit from this. Now, of course, if you have a hiatus hernia, which is the opening of the spine is big and huge, and this is not suitable. So suitability for it, I mean, let us discuss with the patient and decide who actually needs it. Not everybody should be having this. Some people just lifestyle changes is enough. But if you don't.
And this would be also age group
no.
sensitive?
No.
So
anybody can have it. Because sometimes people get reflux and 20-year-old, just out of nowhere, the valve just relaxes and you have no real answers to it. An elderly person, if it's troubling them, causing them that, of course they're not fit for surgery. It can be useful as well.
So you say this is of course called a Stretta, and you say it's a solution that once you do it, you do not have to relook this issue in the next 10 years. So it's a decade.
The studies say that it lasts for 10 years. Now, it is an improvement to whatever you have. So how much will the muscle tighten? Well, kind of easy way to look at it, doubles what you have. If you have lots of muscle, doubles that. Little, then little. At minimum, it should reduce the amount of medicines you're using. And of course, the best answer is no medicines whatsoever.
Of course, but it's safe to say that it would work differently from person to person.
Everybody is a bit different. Sometimes there's some technical element to it as well. But there are certain parameters you must hit for successful treatment, and if you don't hit that, then you repeat the thing on. At the moment, it's a straight away.
All right, so let's walk us through the entire process.
So it's all very straightforward. Now, this may look very scary, but after you get the endoscopy done, you will get the measurement from the mouth all the way to where the sphincter sits.
So it will not be this long?
No. So the markers are here,
right?
And this goes into the person to that level. And the patient is obviously out.
Okay.
They do not know anything. Yes. And this section over here is a little balloon that expands and holds the esophagus in position. And then little needles come out to stimulate the growth. And that's it. So what we do, we put it in the patient.
Just for context, or when you push that button up, there are needles that
tiny
come
little
out.
Come out to stimulate growth.
Those are meant to poke into the muscle to stimulate.
Yes. So at each level, so as I said, the esophagus LES is here. Above it, we stimulate 4 levels, and below 2 levels. So what we do is you put it in, you stimulate the growth, and then rotate it, reposition, and then in the stomach at different points as well, as you can see there.
Yeah.
And the good thing is that you stimulate the growth all around, each different level. And this video should be about a minute long.
So you start from a certain point, and then you work your way.
Yes. So we get the measurement, which is why the first endoscopy is done, to tell us exactly where the lower esophageal sphincter is. Everybody is different, and it is very important that the patient does not move during that procedure. That's why they are anesthetized.
Yeah.
So they don't move, and outcomes are much better, more consistent. Therapy is delivered to all the important places. So you can see the last level is being done now, and as the last one is done, they'll show you just visually about this little cartoon will show you how much it will grow, how much it will tighten at least, and you get that, and it tightens. Now it tightens. It's not a fixed structure.
Right.
So as your body will relax when you have a drink or eat something, it does. You can burp, you can have your soft drink. It will come up. It's not fixed. So it's just like as Gerard said, once it's like sending your esophagus to the gym. I
Get
love
some
that line.
muscles there.
Oh yes.
For it to lift a dumbbell or so. What could possibly go wrong with this procedure? Or is it almost 100% safe?
No, nothing's 100% safe. I mean, you could walk out here and get run over by a bus, you know?
Funny enough, the
anything
doctor
can happen,
once told me that.
But rare.
Yeah.
So no, if the patient is lying down flat, they're not moving, the risk is minimal. Of course, you have to pay attention what's going on. Nothing at all. I mean, of course, the needles coming out. You don't want needles scratching anywhere inside. Hence why the patient is sedated and out. And it's a fairly straightforward, safe procedure. Of course, every patient must be assessed properly, you know. So if they've had all sorts of different surgeries. So for example, some patients who've had a surgery in the past for reflux and it's not effective, can you use this? Yes, you can. Smaller studies have shown that the 7 out of 8 people do get improvement, and to the degree that after surgery they're still using medicines. Once they do Stretta, no more medicines used, no more reflux. So even post-surgery, this is useful. Trouble is, people are not aware of these things, so people don't even ask.
Okay, so you say it's a day procedure. You literally walk in the morning and then you are able to go home after some observation time.
I offer my patients a chance to stay overnight in case they get any discomfort, you know, if they want to rest or anything. But they all want to go home. Nobody wants to stay. 2 hours later, they're out the door and they're like, I feel well. Why do I need to stay?
Yeah,
of course,
sorry to say, Doc, but not many people like your office.
No, nobody likes to stay. I don't like them to stay.
Yeah,
but the option is there. It's just that they don't. Nobody says, this is what I'm getting at, that it is literally daycare.
That's right. Okay, I have a question though. Stretta, that is the brand name, or is it the technology? What are we after?
It's the procedure. That's what it's called. There's no other way to describe it, but don't ask me what Stretta stands for, but Stretta is the procedure that it is. And it's not even to say, oh, we're advertising a certain brand. It's not, because there's nothing like it out there. There's only one thing there. And though you say, oh, there's one thing there, it doesn't matter. You know, people need to know these things exist. Options are available to them. Scopes, for example, if you talk about colonoscopes, your old colonoscopes used to be this big. Only now they're this big if you ask for it, or you get the big ones. You know, options there. Technology moves all the time. So if they want to know what this is, just ask for Stretta, Google Stretta, or whatever you need to do, and there will be only one thing that comes up on this thing. There will not be different.
Right. Do you prescribe this in the sense that would you advise for a patient to go through this if it's a very advanced form of complication, or can you do it at its earliest symptoms?
No, I wouldn't.
Okay.
I wouldn't, because it's a procedure. Don't do anything if you don't have to. Take the least amount of steps to get the maximum result. So any patient comes, I need to know the story first, and to make sure that they've had their medication adequately, and only if it's failed and
they've tried and tested a few
exactly,
options.
Yeah, because you never know. It could be medicines for a short while, some lifestyle changes, and everything is resolved. That's it. You don't need to do anything else, which is the best thing. But if it fails, then you have other options available, which is also quite good for a patient to know that, you know, they don't have to live like this forever, those options there. So yes, also on the reverse, some patients come in asking for this. You have to go through the story properly and make sure that you are doing this for the right patient, but not at the earliest, no.
Okay. I want to go into lifestyle, because we are fast-paced. We are consuming fast food, and not all of us have the time or the option to prepare meals, and therefore, as you've also mentioned earlier, there has been a rise, not just here in Malaysia but worldwide, in terms of people's living pattern, quality of life, and the health of their stomach from that perspective. Walk us through a little bit of what you're seeing at the office with the patients as well, and what lifestyle changes can we begin to make? I
think if you look at the younger group, they think they're indestructible. They just keep pushing, work late, skip every lunch, and go on liquid diets. It never works. Eventually, something will happen, and then it'll come back. And unless they make those lifestyle changes, active changes, meaning that high stress environments need to change or adapted, or at least eat on time, the thing will recur. And when you can solve. And on the other side, older generation is more and more medicines are being given. You know, when someone gets older, it's also important to reduce the amount of medicines they have, because side effects. But the more medicines you have, for very good reasons, the higher chance of gastric irritation.
Right.
And painkillers, older people have got knee problems with the painkillers, and then they're on blood thinners, and that's just trouble for the stomach. And then again, will Stretta be useful for them? No, because yes, it can help, but you want the root cause. The root cause with its two medicines. So find alternatives. They get better. With regards to what you want to do for your stomach, for gastric issues, eat often, eat small amounts, and just keep grazing. Now, you can't always do that, but you can keep a couple of snacks in your stomach, a biscuit or two, some nuts. Good for you.
Biscuit or two or nuts, but people are, these days even skipping breakfast altogether. There's a school of thought, and there's also the intermittent fasting that perhaps gets out of hand. There's also the one meal a day, or as they call it, the OMAD.
Yes.
So there's a lot of things there.
Carnivore diets, and the liver produces enough sugar in the morning, you don't eat breakfast, and so on and so forth. A lot of them are without any evidence. A lot of, for example, the carnivore diet. How much evidence is there for it? Medical studies? Minimal at best. There's a lot more about showing the benefit of plants. So there's a lot of ideas, some people feel great on it. And is it the right thing to do? You have to individualize everything.
Okay, so there's already a lot of things on the table, so to say.
Yes.
Where does probiotics fall into all of this? Because I have people I know personally as well who swear by it, who say that their life has changed.
Yes.
And then another group say we don't need extra, we've already got good.
Yeah, so majority of probiotics are not even from here. They're from overseas, so they are made for people of different origins. We're Asians, they're Westerners. It's completely different. Probiotics shouldn't be given unless it's for a specific reason. For example, certain patients with colitis or antibiotic-associated diarrhea and things like this, or to reduce the risk of it. Given for those indications, it's not for, I got some stomach pain, let's take probiotic. I've got some gastric issue, take probiotic. No, don't forget, there have been studies of sick people who have actually died taking probiotics. It's not the answer. Now, some people get better. Yeah, that's good. But now if they get better, they're going to rely on this for the rest of their life. It's not cheap, these things. About 300 ringgit a month, at least.
Yep.
Surely
they
it's much
take it
better.
as supplements, in fact, like multivites as well.
But that's the thing.
But they're also prescribing it for children.
But why would you need to take it? Firstly, we never needed to take all this in the past. We were fine before, our generation was fine. The problem isn't actually about taking probiotics. I mean, if you need it, take it. But look at your diet, what you're doing. It's probably the lacking in nutrition that you're having that's requiring all these other things, or the toxins that we're consuming. So I'm not a fan of probiotics unless it's specific reasons. Yes, everybody will walk in a pharmacy and walk out with all this feeling good about themselves. Ask majority of them, and majority don't actually feel any difference, but they still persist. Some do feel better. Maybe it helps, maybe. Or maybe they just feel better because they're doing it. So no, there are specific indications for it. Use it for them. Nothing else. Not at this point. Maybe in the future it's different.
So you're saying if you're having stomach pain or discomfort that is already not normal, you should go look out for advice from your doctor.
Yes.
And hopefully no one needs to get to this point. But if you need to, there is a solution, an effective one.
A one-off.
A one-off solution.
It's a daycare, 30-40 minutes, and the reflux goes away for at least 10 years. That's surely worth your time, isn't it?
That's right, and it's almost painless as well.
It is. It really is. Considering we're stimulating growth, and you come out, you just feel some discomfort here, and that's it. It's worth it, definitely.
Done. All right. Before I let you off, Doctor, what is your message to people regarding taking care of their health overall? But of course, it all starts from the stomach as well.
It is, and I think it really goes back down to what our parents, grandparents will say: eat properly, eat fresh food, whole food. And know where it's coming from. If all the broccoli looks exactly the same, something's not right with all the broccoli. Organic grown one is a little bit different from that. It comes back down to our diet, our gut bacteria, and now what our gut bacteria needs is plants and fiber. So feed it the right stuff and you will get better. It may take time, it may take a month or two, but you will get better. There are no shortcuts. No shortcuts.
Do you recommend then a strictly vegetarian diet?
No, definitely not. You
must
get deficiencies.
have a balance as well.
Have balance. Adding more plants or the fiber content, not bottles of fiber, eating actual food to your meal will certainly help, even if you're doing the wrong things. And it also help with things like lowering cholesterol, reduce cancer risk, and weight loss.
Right.
What's not to like?
I see you have a drink in front of you there,
Yes.
and I'm probably guessing that's coffee.
Of course.
So coffee, yay or nay?
For your liver, it's very good.
Yep.
Everybody drinks it. Enjoy it.
Enjoy it.
If you comes on, have Stretta. You'll be fine.
The best guest I've ever had. Enjoy your food and drink your coffee. Thank you so much, Doctor, for being here with us, and of course, telling us a little bit more about the solution that's available. It's called Stretta. If you'd like to go find out more about that. This has been The Nation. Thanks so much for joining me, and thanks for watching. Bye-bye. Thank